Hello, and welcome to the next part of the series where Europe Direct answers your questions on the Covid-19 vaccinations. My name is Laura, and I work in the Europe Direct Information Centre based in Clones Library. And today I'm delighted to be joined by Dr. Illona Duffy, a GP in a very busy Monaghan practice. So thanks a million for joining me today, Dr. Illona.
You're so welcome.
We'll get started straight away because I know time is precious at the moment, especially for yourself. So I suppose, could we start maybe with learning a little bit from you about how your practice and working life has changed over the last year?
So much has changed, and when you think that just a year and a bit ago I'd have been coming in every morning to knowing there'd be a full waiting room within an hour of the surgery starting, queues of people, that's all gone. I think every GP practice now is different, working in a new and different way, which is challenging both for us and our patients. And so now I suppose our first port of contact now is a telephone consultation with our patients, and we do have some patients for specific things like antenatal checks who are able to directly book and come in and know they'll be seen without having to be triaged for COVID symptoms, etc. But still, because COVID is so prevalent out there, and while we and our staff are vaccinated, there is a risk of somebody coming into the waiting room who, unbeknownst to themselves, has COVID, is still asymptomatic, spreading it to others in the waiting room despite the social distancing. So for that reason, I know it can be difficult for many patients to feel they have to ring, they have to talk to the doctor. They sometimes feel that it's a barrier, that we don't want to see them. I can tell you, we all want to go back to seeing patients. We love seeing patients. The chat, it's more relaxed. It's a much more difficult consultation for us doing it by phone. And again, I suppose we've adapted as well, offering some video consults where we feel it's appropriate and where we feel somebody has good enough, number one, Wi-Fi coverage, and number two, that they're able to manage the kind of the system to do it. And obviously people sending us in photographs of rashes and of lesions, skin lesions, is fantastic. Not only because we can look at them more clearly and zoom in on them, but more importantly, because we can see, has our treatment worked? And we're able to actually go and look at, let's say, an updated photograph a week or two later. So it has a good and bad things, but we hope to see ourselves being able to open up more and more as time goes on.
That's great. So it's changed quite a bit, but you're still there and ready and willing to meet anybody who needs to see you at any stage. And that's a good message, I think, to get out there as well. But of course, a GP in a border area has brought its own difficulties during these times. And what have you found most challenging in this regard in relation to the COVID-19 pandemic?
Well, I suppose what's been different for us in comparison to GP colleagues further south of the border, and there have been a lot of differences. I suppose the big thing for us has been the challenge of having two sets of guidelines, one north of the border, one south of the border. And that really became very, very obvious after the summer when we started to see a rise in cases again in the south and especially in the border counties. And we knew that the rates were really high in the north. So we kind of went into a lockdown, but unfortunately across the border, there wasn't the same level of lockdown. And, you know, people are aware that they're not meant to be traveling, but you know, it's very hard to keep to that. And if you have family members maybe living on one side of the border and you're on the other, work, obviously people had to travel, but also for things like shopping. And in the lead up to Christmas, we know there was a lot of flux one way or another. So when the south opened up, the north was still in some restrictions at that stage. So that has created difficulties. And again, for us, even with follow-up of positive cases, what we found, especially after Christmas, was that many people had kind of visited family and friends in the north and may have been in contact with someone who was positive for COVID, and they required contact tracing. They required a public health person to ring them, offer them advice on how to manage things, how to self-restrict at home, how they should be tested as close contacts. And unfortunately, that wasn't adding up. There was meant to be kind of liaison both north and south of the border, and it wasn't. So as GPs, that fell to us to undertake that role and to advise people. And you know, we were happy to do it because we all wanted to ensure that we saw a dampening down of the cases, which unfortunately didn't happen for some period of time.
So there was quite a few challenges, and maybe some of them still need to be overcome. A lot of extra work fell to yourselves, you and your colleagues, in order to...
Well, the important thing is we still need to look at an all-Ireland approach for certain health models. And we know we have very different, but yet somewhat similar health models on either side of the border. But the important things are the public health messages and messages with regards to if we have to do a lockdown. We were able to do it for, you know, farming issues like hand, foot and mouth disease many years ago. We all sang from the same hymn sheet. And I think it was just disappointing and a pity that we couldn't do it for the COVID and the health of the nation.
Yes, but of course, the good news is that the vaccination process has started. And
It has.
according to the European Centre for Disease Prevention and Control's COVID-19 vaccine tracker, 12% of the Irish population have received the first dose of the vaccine. And Ireland's first dose vaccination rate is actually ahead of the EU's average. When people come in to you now for the vaccine, do you find that they are nervous about getting it, or are they excited? Do they see it as a start of something to come?
Oh, I think around the country, every GP is saying it's such a different aspect to general practice, something we've never seen. Often with vaccines, you know, while people know they're important, from our childhood vaccines to flu vaccines every year, there's a bit of work to persuade people to get them. At the moment, GPs are responsible for vaccinating our patients who are over 70 years of age. So we're not doing the at-risk groups, we're not doing the general population as of yet. So again, those people are people who have really been imprisoned in their homes for over a year, many of them. We had people coming in telling us that they actually hadn't left their home at all except to come into us. This is their first outing. They hadn't visited a family member, they hadn't been to a shop, they'd been nowhere unless it had been to another hospital appointment. And to imagine that your life is on hold for so long, especially at a time when, you know, they don't have as many years left over as maybe people who are younger. So the impact on them has been huge. And it was just wonderful that they and their carers and their family members were just so happy to get a call from us to say, we've got some vaccines, we're offering you an appointment, will you come in at X time and get it then? So I can safely say that overwhelmingly it was a yes, when can we get in? And I think, you know, unfortunately the one part of that is that it's so successful that we haven't been able to keep up with it, and we are aware that there have been difficulties with the supply of vaccinations, so that has slowed and curtailed us. And again, there has been some frustration from people who haven't been vaccinated, perhaps believing that it's our fault, and it's not. It's nobody's fault. It's not the government's fault, it's not the HSE's fault. We're not producing these vaccines in Ireland. We are reliant on importing them in from other countries, and therefore if there are problems, which there have been many of, it slows things down. But I suppose for us in our practice, we were delighted today, and are really delighted to get a phone call to say that we're guaranteed a vaccine delivery next Monday to give the second dose to those who, the 200 patients we've managed to give the first dose to, but also that it's highly likely we'll get extra doses and we'll be able to move and ensure that we've vaccinated all our over 80s. So we're delighted to hear that. And I think that's a message to get out there to everybody. Your turn will come. I know it when it feels so close, especially for the over 70s, you want to get it. And perhaps if you're someone who is at risk, who is poorly controlled diabetes, who's a transplant patient, that imperative to get the vaccine seems even stronger now because you can see it in sight, but it is coming. And I think just to keep adhering to the guidelines and wait your turn, and you will be contacted about it.
That's great. And I think it's heartwarming that getting the contact between your patients again, and the buzz that it might have given them, and you know, the heart it's given those older people to get out there again, and the confidence is just, it's so important for them. And Ireland, of course, is due to receive another 46,500 of the Pfizer-BioNTech vaccines by the end of March. And with the Johnson & Johnson one having got approval, we're to receive another 600,000 of them. So that's all good news, and hopefully will speed up the process and make up for the delays that there has been in some of the arrivals of the vaccines into the country. So
and remember, the Johnson & Johnson message is even better, because that's the equivalent of double that, because only one vaccine is required. So when we hear, sometimes people are hearing the numbers arriving into the country of the other vaccines like Moderna and AstraZeneca and Pfizer, and kind of thinking, well, why does it seem that so few have been vaccinated? But what everybody's got to remember, for every 2 vaccines that come in, only 1 person will ultimately be vaccinated, because you require 2 doses. So what happens is, if 100,000 come into the country, 50,000 will be sent out for distribution, but the other 50,000 will be kept safe to ensure that you are absolutely guaranteed you will get your second dose at the appropriate time. So you never have to worry about shortfalls in vaccine deliveries to the country. Your vaccine has already been saved for you for that second dose.
Oh, that's brilliant. And when you do need a second dose of a vaccine, do you get a date for coming back for the second dose on that first visit?
Well, in general practice, the GPs are doing that, because we know it's 4 weeks apart. So what's tending to happen to make it easy is that you'll be advised this day 4 weeks, same time, same place, same day, just a different date. And I think that's what's happening in the majority of cases. In the hospital setting and some of the community setting, I think the majority of them are actually giving them a time, but if they don't give it on that day, they're ringing them or contacting them to let them know that they are being called for their second dose of vaccine. And again, I suppose that's another thing, depending on which vaccine you get, there are different timeframes between the first and the second. For, when the vaccine started, when I got my vaccine, it was 3 weeks between my first and second dose, but Pfizer is what I got, and that's what many GPs are giving. We're actually using Moderna. It's 4 weeks. But if you're getting AstraZeneca, it's 12 weeks. And I suppose, again, there can be some confusion with people thinking, well, gosh, why am I being left so long? Surely that's not right. Surely it should be 4 weeks. I know somebody else who it was only 4 weeks. That's the appropriate time, and that's the best time. And we know specifically with the AstraZeneca, by leaving it that little bit longer, especially for younger cohorts, younger groups of patients, they get a better result and get a better immunity.
That's great. And it's good to know the difference in the different vaccinations and the timelines needed between them, because I do think people get a bit concerned if they haven't heard back for their second dose within that time period. So there is different ones for each vaccination, and that's good to bear in mind. When you are looking to get your vaccination, do you need to make contact with your GP, or is there an online registration process that people should be made aware of or anything like that? Or is it just as each group is rolled out nationally that you'll be called by your GP?
So at present, the people who have been vaccinated are being contacted directly by your GP. So again, in the age groups starting over 85s, over 80, then over 75s, over 70. And your GP practice will contact you about the vaccine and offering you a time and date. So I suppose ringing's not going to speed it up, but sometimes ringing, especially if you feel maybe a mobile number isn't on file for you, or that your contact details have changed, I think then it can be worthwhile just ringing saying, listen, I just want to make sure you've got the correct contact details for me. And I think that's especially helpful if you have an older relative, or perhaps if you are a neighbor of an older relative who may not have a mobile phone, who may be poor of hearing, who may have visual impairment as well, and who therefore, all of those things are challenges to us contacting them, and perhaps them missing the appointment, especially if somebody maybe with a little bit of early dementia. I think it would be important for family members or carers just to ring in and say, listen, can I give a contact number for when you're contacting? And also we may then want to clarify a PPS number with you as well for the patient, because we require that when we're sending in the details, because when we give the vaccines, we immediately enter it online and it's sent back, so the government are aware of who's received the vaccine, when they've received it. And again, hopefully that will allow some freedom of movement in the future, because there'll be online lists of who has been vaccinated and who hasn't. Now, you mentioned the online portal, and that is to come. It's already been used for healthcare workers, that they registered and they were able to arrange their vaccinations. And the hope is that when we move past the groups we're in at present, meaning the at-risk groups, and we start looking at the general population, as they're doing in the UK and in the North, because many people may be aware of people in the North who aren't at risk and who are younger, or maybe in their 50s and 60s, who are being vaccinated. It will be through an online portal, and that will be well advertised by the HSE, and you'll be advised what you need to put in. And again, it'll be the usual. It'll be contact details, ideally a mobile, perhaps an email address and a PPS number.
That will take some of the pressure off the GPs as well. You'll be hoping at that stage.
I think we're not expected. We won't be giving the vaccines in our surgeries to the other groups. We're dealing with the over 70s, and the hope is, and I really hope that we can get them up and running soon. And I think it all depends on vaccine supply to get the vaccine centres. And as people are aware, in every county there is a centre. Majority of them in kind of closed hotels at the moment, which is actually really handy because lots of parking. But they're all kitted out. They're all set up and ready to go. Staff are trained up. So I think as soon as we're guaranteed a ready, steady supply of vaccinations, then the vaccine rollout for the general public will be able to start. And I think it'll move fast. There are plans that it'll run 7 days a week, 12 hours a day. So I think we'll be able to get through lots and lots of people, similar to the UK.
That's fantastic. We have a few questions coming in from the public for you today. So I'll start with this one. How should you prepare for your vaccination when you're going for it? Is there anything that would help the GPs in relation to speeding up the process, if you like?
I'm smiling because absolutely yes. So if your GP asks you to either go onto their website and read the details about the vaccine and consent to it, or if they advise you to come to the surgery and pick up a consent form, bring it with you on the day, signed, have it ready to go.
Okay.
When you're coming, we know it's still cold out there, but ideally wear a warm coat, but only one layer underneath, and ideally a short sleeve. It's really important we can get at your arm easily. And we are finding still maybe people coming in with 4 or 5 layers, and it takes 3 or 4 minutes at least to take those layers off. And I suppose because giving the vaccine is very quick, it's a simple jab into the arm. Most people say, is that it? Gosh, have you done? They're so surprised at how easy it is. But you have to sit for 15 minutes in the surgery with us. And that's where I suppose time goes by. And we're trying to make sure we can get as many people in and out as possible. So if you could speed up things by only having the coat and a short sleeve underneath it, wear your absolute warmest winter woolly coat, but only a short sleeve jumper or shirt or something underneath, and that would speed things up. Please attend on time, because remember, I mean, everything is very kind of regimental. We're getting you in at a specific time. There's no point in coming earlier, but don't come late. Whatever you do, don't come late.
Some good practical advice for us all there. Another person we have is asking the question, they're cocooning at the moment, and they'd like to know what are the side effects of the vaccine.
Okay, so side effects are relatively common, but the majority of side effects are not something to be worried about. And I suppose 1 in 10 people or less are going to be, or rather more so, the most frequent group would be pain at the site of the injection, which often develops over 24 to 48 hours. With the first injection of the Pfizer and Moderna, it doesn't tend to be as bad with the first. It tends to be a little bit worse with the second, probably because you already have a partial immunity and you're developing more of a reaction. Also, it is common to perhaps get shakes, feel shivery, run a temperature, have a headache, and have aches and pains. Some people have reported feeling nauseated and having diarrhea. So they're the common group of side effects. Easily managed. Stock up and I suppose have some Panadol in the house and take those as you require them, both for the pain and if you're running temperatures or if you have the aches and pains, and it will work well. It's expected that any temperature from the vaccine should only last up to 48 hours. So if you're still feeling unwell after 2 days, that's the time to make contact with your doctor. Okay. And there are rare side effects, and I suppose there's probably some concern in the public because at the moment we're still hoping to see AstraZeneca come back online, and it's looking really positive. I think all of this is news. So if there's anything that's deemed concern, we're probably going to react very aggressively, pull a vaccine, stop giving it for a short while until we can be sure there's nothing to worry about. And while that can seem to create some concerns amongst people thinking, gosh, is it a dangerous vaccine? Should I be getting it at all? Be assured that millions and millions of doses of vaccine have been given throughout the world, and that we're kind of behind things. So we're learning from other countries and their experiences and the data that they have. So we can reassure you that if there's any question about its safety, you won't be given the vaccine. So therefore, if you're being offered it, you can be sure that we as medics and those who have all of the information, the data, like the chief medical officer, are reassured and are confident that it's going to work and work safely on you.
That's great. I think it is reassuring that the healthcare authorities are constantly reviewing the vaccination programme, even throughout its rollout, and that patient welfare is always put at the heart of the decisions, even the difficult ones of pausing a vaccine. But hopefully there will be good news on that later on today. We have another question from a member of the public who wants to know, can you still get COVID-19 after having the vaccine?
Yes, very good question. So I suppose the vaccine is to protect you from getting serious side effects as a result of COVID. So ideally, it's to protect you ending up in hospital, ending up with respiratory difficulties. But it doesn't stop you actually getting it. So if you meet COVID, you can still become infected with it. Now, as time is going on and we're getting more wonderful data about the vaccines, definitely the data from Pfizer and Moderna is suggesting that your ability to infect others is also reduced, and that therefore you're not a risk. So prior to this, we were telling people if you're vaccinated and you are close contact with somebody, you're going to have to restrict for the full fortnight, as you would have even if you hadn't had the vaccine. But we now know that actually your risk of giving it to others is much reduced, and therefore you're not going to pose as much of a risk. The guidelines will remain the same, however, for the time being, until we've absolutely can be sure of this and until we know the benefits of this and how long it lasts. So at the moment, if you are vaccinated 2 weeks after your vaccine, after your second dose with the Pfizer and the Moderna for sure, and I think with the AstraZeneca as well, it's deemed that you are protected. So you will not become seriously ill, or the risks of that are very, very small, but you still have to take precautions in the event that you've been exposed to the virus.
Okay. So if you do have symptoms even after getting the vaccination, should you
I
make an
think you
appointment for a
contact us.
test?
Yeah,
Yeah.
you contact us. So what our advice is that if somebody rings us and they haven't had their 2 doses and they become symptomatic, then absolutely we refer them for testing. And the guidance seems to be that if you've had your 2 doses, that we don't have to, but we probably are going to for the time being, because again, that's how we're going to gather data on understanding, did you get an infection? Are you symptomatic? Because again, it is back to the thing that you may get mild symptoms, but you're not going to get the severe symptoms. But we need to know if you have it, because if you have it, as we've said, there is still the potential for you to spread it to those around you, and they need to be protected by staying home and restricting their movement. So yes, in a nutshell, if you develop COVID symptoms, we're still likely to be referring you for testing for COVID to ensure that you don't have it and aren't a risk of infecting it to others.
Okay. And what is the latest advice for pregnant women in relation to getting the vaccine?
So the advice has been that the mRNA vaccines, which would be Pfizer specifically, would be the most common one, and Moderna, are safe for women to get, and they get it from 13 weeks pregnancy up to 33 weeks pregnancy. You have to have had your first dose before 33 weeks pregnancy. And that's still been recommended. It's not been recommended for all pregnant women at the moment, so they haven't included pregnant women in the at-risk group, and that's I think under review, and they may well be added to it. My understanding is that the AstraZeneca is not being given to pregnant women in Ireland. That's the guidance at the moment. So I suppose those women who are deemed high risk, and they may be women because they have severe diabetes or women who have other medical complications, will be contacted by the hospitals and offered the vaccine. And again, I suppose we always find it difficult to, women worry. We don't tend to worry so much about ourselves, we worry about others. And I think as a mother who's pregnant, you worry about your baby and wondering, well, could this vaccine do harm? But again, the worldwide data is that it's beneficial, and it also protects those women who are offered it.
Okay. That's great advice. And I suppose if they have any queries, it's again, contact your GP or your
their
obstetrician.
Yeah. And again, can I just say one word for anybody who is pregnant and who does test positive for COVID? And if you're deemed positive for COVID, you immediately contact your obstetric team, and they're going to arrange further scanning on you, because as people may be aware, there were 4 tragic cases where babies were born stillborn, and that really is very upsetting news to hear. I suppose the only reassuring thing is that the worldwide data is stating that there has been no increased risk of stillbirths since COVID has started worldwide. But again, these 4 cases were here in Dublin in Ireland and seem to be related to an inflammation of the placenta. That can be monitored on scans. So therefore, any woman who is COVID positive will have increased scanning to monitor her, and that can be treated.
That's great. We'll finish up maybe with this last question, maybe for you, Dr. Illona, and it's, have you a message yourself that you want to get out there for anyone who may have a non-COVID related health concern at the minute?
I think that's a really important point. For so long, we've been kind of creating this sense of fear and telling people, stay home, don't go out anywhere, stay away. And the people who are going to listen to that message most are those who have underlying health conditions. And therefore, they're going to feel, I shouldn't be going anywhere. And that, on many occasions, can include feeling that they shouldn't attend a hospital appointment or attend a hospital test, or even come into their GP if their GP wants them to come in. And more importantly, at really critical times, avoid going to hospital when they normally would have, let's say, with severe abdominal pain, kind of say, oh no, I'll wait it out, I'll wait and see if it gets better, and unfortunately put themselves at risk. So what I would say to you is, you will be safeguarded into whatever healthcare setting you go to. If you're advised to come for an appointment, for a test, be it the hospital or in your GP surgery, do go. With regards to the hospital, before they admit people, they are arranging COVID tests to ensure you don't have it, which means that it's ensuring those around you don't have it. All hospital staff have nearly been vaccinated at this stage. So again, you're protected from them potentially giving it to you. They're also being monitored and screened on a regular basis. So I think the most important thing now we have to ensure is that we're not finding people's health deteriorating with non-COVID related problems, that they're not ignoring breast lumps, that they're not ignoring chest pain. So I think, we are open for business, both in general practice and in the hospital healthcare setting. Contact us. We're there to help, and we don't want you ignoring your problems.
Thank you very much. I think that's a great point to finish up on. Thanks so much for taking some time out of your very busy schedule today to join us to do this interview. We're really glad to learn a little bit more about what the vaccination process is like on the ground at the moment for GPs and for the general public who will be going in to receive their vaccines. And I think it'll have helped people feel more reassured about going in to get their vaccines as well. So if anybody watching today would like some more information on what we have been speaking about, there is trusted and reliable advice available through the other videos in this series and on the European Medicines Agency's website, which is ema.europa.eu, the HSE website, hse.ie, and the Department of Health website on gov.ie. The gov.ie website, of course, also includes information on the Keep Well campaign, which is really important. It has some useful tips for us all in relation to minding our physical and mental health at this time. And we all need to take some time out for ourselves, as it's been a very stressful time for everyone at the moment. So thank you again, Dr. Illona, for joining us today.
Thank you. Bye.
Bye-bye.